It is Friday at 5 p.m. This is when we come together, provide an update on the coronavirus, and we recommit ourselves each and every day to doing what it takes to defeat this adversary. I want to start like I did yesterday, and I want to keep doing this every day. And that's by us saying together what we know is true, that we will get through this. We will get through this together. And I want you to say it with me. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. May seem hokey, but in the next weeks or months, it's going to take all the strength that we have, and it is our collective strength. It is all of us coming together unified as patriotic Americans and Kentuckians that is going to protect the people around us. I said yesterday that I've never been prouder to be the governor of the Commonwealth of Kentucky. It's absolutely true. What you all are sacrificing and what you're doing is amazing. So tonight, as promised, we're going to start with a video. This is made for elementary school kids. I have two of those. I have a son, Will, who is in 5th grade, and a daughter, Lila, who is in 4th grade. And as they're living through this, they have to hear a lot about this with me on the phone and doing other things. My daughter came across a quote in one of her favorite movies right now, and the kids can tell their parents what this is, but I'm going to leave it with you, and we'll start the video. When no one can see the future, all you can do is the next right thing.
You know that kids sometimes show stress responses also, and sometimes in ways that are different from the ways that adults show those responses. Kids may be more aggressive during this time or cry more than they typically do. They may have increased separation anxiety, and that could even include like difficulty with parents going into the other room. They might have difficulty with sleep patterns or eating patterns. They're more hungry or less hungry than they typically were. They're having trouble at night with nightmares and things like that. Kids show anxiety in lots of different ways. They know what's going on around them, and we sometimes assume that because they're young children, they don't know what's happening, or they aren't as in tune with what's going on, but they're very attuned with their caregivers' responses and what's going on in the environment. So I think being honest with kids as much as possible, but also parents recognizing that it's important to take care of themselves during this time. Some things parents and caregivers can do to make sure and decrease some of that stress response for kids: get down on the floor and play with your kids. Find times every day to get outside and take a walk. Look for the sensory things around you. What can you see? What can you hear? What can you smell? What can you taste? And also helping keep your kids on a predictable routine. Put up a visual schedule. Come up with the things that you're planning on doing that day. Something else we can do for kids is make sure to offer choices whenever we have choices to offer them. It helps increase their sense of control and the ways that they are able to control situations in a relatively uncontrollable time for a lot of kids. Continue to provide ways to get together with friends, maybe social distancing, do a FaceTime call with a friend of theirs or a cousin or somebody, grandparents, things like that. If we can't physically get together in person, we can still provide some of that social connection for kids that is so important. And again, predictability and routines, and making sure that we recognize that behavior that we're seeing in our kids is kind of the tip of the iceberg. It's really just kids showing us that they need something connected for them. I think a lot of times we talk about attention seeking with kids, and if we can reframe attention seeking as connection seeking and recognize that those behaviors are ways that kids are reaching out to us to connect with us and find ways to feel safe and secure in a scary time, then I think that's the best thing that we can work to provide for our children.
Hello, I am here today to talk with you about things that you can do at home with your children during this time. I know for many of you, you're wondering what are some different tools that you might have around your house, and I brought some here today to share with you. I do want to remind every parent out there that the best thing that you can do during this time with your child is to remain calm and connect and to read. When you read with your child, they associate reading with love, and they also learn that words have meaning, and those meanings can make up thoughts in a book. If you have an infant at home, soft books like this are a really great thing to be able to read on a daily basis. You can talk about shapes and colors and textures, and they can hold the books in their hands while they read with you in your lap. If you have a toddler or an older child at home, you can use books that encourage different patterns and repetitions, such as animals, which I really like this book because you can talk about the different sounds that the animals make and the different jobs that they have on a farm. You can also talk about the different colors that you see in this book. When you read with your child at home, it's a really, really great opportunity for you to be your child's first teacher and to be your child's best teacher. As you are working over the next couple of weeks, you can use items like this bowl and wooden spoons in your home, from infants all the way on up to toddlers and to preschoolers. They can do different things. Babies love to tap on bowls and to make different sounds, which is a really, really great learning experience. And with your toddlers, if you get brave, you can put different items like water, or if you have rice or beans that you're willing to use, to go ahead and stir around and to pour and to play with that. And that will give you some really great opportunities to learn at home in the kitchen. If you're like me, I have my 3-year-old at home with me now, and my husband, and we've been working from home the last couple of weeks. We have a lot of laundry, and so laundry is a great way for you to connect with your children. For babies, you can hand them socks, and they can experiment with the different textures under your supervision, and you can also talk about colors and shapes and patterns and matching with older children. My 3-year-old is getting to the point where he's able to match socks with us, and we're able to fold them up with him. During this time, I really want to encourage you to remain as calm as possible and to reach out and to connect with your children. This is what they will remember most during this time, is the safety and the connection that they feel at home with you when you're reading a book with them in your lap, or when you're remaining calm and doing fun things like cooking in the kitchen or playing with different things in the laundry.
All right, I want to thank our folks at the Cabinet for Health and Family Services. And we're going to try every other day or every third day to just have a video targeted to different populations, because the stresses can be different depending on where you are in life and what's going on at home as we deal with the anxiety that is the coronavirus. Now I'm going to talk about the good things we see out there on social media, give people a chance, if they've got younger kids, to potentially move them away from the TV. And then we'll talk about our update from today. So each and every day, we talk about the good things that are going on out there in Kentucky. We talk about it because the only way we can truly reduce contacts the amount we want is through people buying in and through encouragement, as opposed to enforcement, which we also have to do. But the more that we can model the behavior that we want people to see, the more that we can express our joy with even doing the things that are hard because we know how important they are, the more other people will join in. So here's some of our selections from social media today. It may be a little bit hard to see this. This is the Shelby County EMS. And what they're saying is the best way that you can help them as first responders who put themselves not only in harm's way, but exposure to coronavirus every day because of what they need to do. The best way that you can help these EMS workers is to be healthy at home, is to make sure that you are staying at home other than getting groceries and maybe getting out for a walk. But even in those instances that we don't use it as the type of social hour that could ultimately frustrate what we're trying to do. You know, these people know that they're being exposed to the coronavirus, and they do it anyways because they want to help you. The best way you can help them is to follow all the healthy at home guidelines. So here are our kids being creative, using art, trying to make sure that we are as productive as we can with them during this time, keeping a schedule. And as we move through the next week, we're going to try out of the governor's office to provide more activities that we can encourage, especially for your kids at home. Our social workers right now, what they do and having to find creative ways in some instances to do it is still so critical. We cannot lose our compassion. We cannot stop caring about the people who need our help the most just because it may be more difficult to interact with them directly. To all of our social workers out there, thank you so much for what you're doing. I like this one. We have talked about how social distancing is not social isolation. And we live in a world right now where there are more ways to connect with each other than ever before. And maybe my family waited a little bit too long to do it, but my kids are now doing either Zoom or FaceTime with their classmates, are doing it with my parents and my wife Brittany's parents, and just seeing the positive reaction to it and how much that it can lift them up. To everybody who has that capability, do it. Do it for yourself, even if you don't think you need to. Do it for your kids. Make sure you're taking time each and every day to use technology to connect to the people that you love and connect to the people that you like. This is one of our great members of our National Guard. Our National Guard right now is out there helping us with response to the coronavirus. They're helping us at various hospitals, just making sure that things are orderly. They're helping us in a number of other ways, and we may have to call on them to do more. Remember, these are your neighbors. These are your friends. These are folks that work a job right next to you until they are called to help out their Commonwealth, and they always answer that call. They are heroes. And, oh my goodness, our custodians, our cleaning crews, all across the Commonwealth, my goodness, thank you for what you do. I mean, right now we are fighting an adversary where you are also on the front lines. What you do makes everywhere safer for the people who are there. I hope that you feel appreciated. We need you now more than ever. So we want people to keep it up. We got to keep modeling the type of behavior we need to reduce our contacts. And so if you'll use the hashtags Team Kentucky, Together KY, hashtag Patriot, because it is your patriotic duty to do this, and also Healthy at Home. That will help us ultimately protect the people that we care about and that we love. All right, we've talked about it the last couple days. These next couple weeks are absolutely critical. If you turn on cable news or the internet, you see that we have very, very large surges going on in various parts of the country. And we have the blessing, in a way, of time. While we are seeing an increased number of cases, we have more time than they do right now to make sure that we reduce that curve, that we limit our contacts, that we have fewer cases, and we make sure that our healthcare system can ultimately serve everyone who needs it by doing everything we can. These next 2 weeks are critical. And I believe that Kentucky has been doing better than just about anywhere else in the country, but I need you to do better because we're not competing with another state. We're competing for the health and the lives of our people. So the only people that we should be competing against is ourselves, and we should want to do better every single day. So it's Friday, and it's beautiful outside, and it's going to be a nice weekend. We cannot use that as an excuse to undo all the good things we're doing. The sacrifice that people are making is too important, and we've got to make sure that we continue our social distance even when it hits the weekend. So I'm asking everybody to dig deep. The better that we can do, the more that we can do, especially the next 2 weeks, is going to make such a difference in people who need us. While most people out there are doing the right thing, there are still some areas where people are coming together and not doing the right thing. So I have asked our county judges and mayors to close any public playground or any basketball courts or anything like that where people have shown that they cannot engage in social distancing, or whether they refuse to ultimately spread out to exercise, but on their own or with their families. This is the next step we have to take, because with everybody who is not going to work right now, whose business is closed, everybody who is making all these sacrifices, we can't allow it to be frustrated either by folks on a basketball court or by folks that are going to the grocery store, but all of a sudden see it as a great opportunity to engage in the social opportunities that we don't have right now. We need everybody to know in those most tempting situations, we have got to stay strong. because, again, it's the health and the lives of our people that we're talking about. Before I hit our update, I want to ask Eric Freelander to come up. I was asked a question about initiatives for the homeless yesterday, and he has an update on that.
Thank you, Governor.
Thank you.
Thank you all. When I was in Metro Louisville, working for Louisville government, I worked on homelessness issues for the city of Louisville. And I never start talking about issues with homelessness without saying thank you. Thank you to the workers who go into the homeless shelters, who go into the day shelters, and especially those folks who do what is called street outreach. These are all volunteer, unpaid people out of the kindness of their hearts, out of their concern for their fellow neighbors, go out into the camps themselves, create relationships with folks who are homeless, and help them get to services. And I know they've been working especially hard during this time, taking out hand sanitizers and meals, and informing folks who can't come indoors, who don't know how to come indoors, helping them get to services. And those folks, again, as you always say, are heroes. Those are also more heroes in our midst that we don't always recognize. So, issues with the homeless, people who are homeless, existed before we had this virus. We didn't have enough services. We didn't have enough places for folks to go. We didn't have enough housing. And now our systems are even stressed more greatly. So the first thing we do is try to prevent more homelessness. Governor, thank you. Stopping evictions, stopping more people going on the streets is exactly the thing we need to do. Expanding unemployment insurance, that's exactly what we need to do to prevent more homelessness. We at the Health and Family Services Cabinet have asked the federal government to allow us to provide some temporary housing through our Medicaid program. We'll hopefully get a positive result from that, but we're going to do everything we can do to provide enough services so that we can help people get housed through this time. We're going to expand our energy assistance programs. We're going to expand what we're doing in food stamps. All of these things we are working on right now. So the Kentucky Housing Corporation works with all across the state with homeless shelters and to provide housing. They have provided guidance on their website. There is more HUD funding potentially coming down through the federal government. And so we will continue to work with all of the folks who provide homeless services across the state. We've been in touch with the major organizations both in Louisville and Lexington and for the rest of the state. So what we're asking is for local communities to work together, for local health departments, for their comprehensive care centers, for their homeless services, for their emergency management, to come and together and work on their plans for their homeless population. And we're going to have to be creative. There is not enough PPE to go around. We don't have enough for our healthcare workers. We don't have enough for the social workers at the Cabinet for Health and Family Services. We don't have enough at this point. We are working on it. And know, those of you who are working with the homeless population, you are on our radar to get that to you. We simply don't have enough right now. So local communities have done some really interesting things. I know that Lexington is working on providing mobile showers. I know that Louisville has provided some additional funding to open some larger shelters, and that's the kind of response that we're going to need. The Salvation Army has stepped up to provide some additional day shelter for men and women. These are the types of things that we're going to need to have. I know Lexington, the city of Lexington, has been looking for some of the larger warehouses and larger spaces so that they can work with their homeless population and help get them off the street. So we've asked Cabinet for Health and Family Services, We've talked to our comprehensive care centers to ramp up their services. We've talked to our state-owned and operated facilities to not discharge unless we know that there's a stable place to discharge somebody to. These are all things that we've asked from all of us to work with and for and on behalf of our fellow Kentuckians who happen to be homeless through this period. So, again, we're asking our local communities to work together. We've had some local communities try to ship some folks to different locales. Don't do that. We don't need to move people from one place to another. Work on your local problems together. So we know that this is always going to be a balancing act. And as I said last time, this is not always about best practice in the way that we used to think about it, but best practice is to stop the spread of the coronavirus.
Thank you. Next, can you put up the new folks who qualify for unemployment? We were very excited this week, and still very excited, to the fact that here in Kentucky, we've been able to expand who qualifies for unemployment to ultimately address a system that was not fair in light of the coronavirus, with so many folks that are struggling, whether they're small business owners or independent contractors. But just like when we called for people who qualified initially to sign for unemployment, sometimes it takes a little time for our systems to catch up. And yes, there have been more than just glitches. There have been some people told incorrectly that they don't qualify. And what we need from you is patience. But I'm going to ask Josh Benton to come up to explain what we are seeing, because it is better news than some might initially see in what they get back. Josh.
Thank you, Governor. So we do realize that some of you who we opened unemployment insurance up for this week are receiving information from our system that says that essentially that you don't make enough wages that qualify under unemployment insurance. We realize that. We want you to know that that is not stopping your claim from being processed. So you do not need to reapply, but know that next week you will be contacted by our office to let you know the status of that claim. It is being processed and it will be approved. We opened this up. It's something that for those of you who did not traditionally qualify are now eligible for. And so I know that information that many of you were receiving today was alarming, but don't be discouraged by that. The claim is still being processed. You are eligible, and those claims will be just processed in the normal order of time. We're working on our systems to have that corrected, but for those of you that receive that piece of information about not qualifying, don't worry about that. You'll be notified by us next week with the status of your claim.
So when we initially saw that, I reached out to Josh. It's going to be fixed. We want to be there for everybody. Again, there is no stigma. This is a difficult time. We want to make sure that everybody has enough to get through this. We have had major disruption, though that doesn't seem like a big enough term anymore, in our economy and in the lives of our people. We want to be there for each and every one of you. So please, sign up if you qualify. All right. Before I hit today's update, I want to specifically talk to those that live on our border with Tennessee. And if we could put up that slide. As you know, here in Kentucky, we have taken very aggressive steps to try to stop or limit the spread of the coronavirus, to try to protect our people. We have made major sacrifices, such as shutting down bars and restaurants, nail salons, and all these forward-facing businesses. But our neighbors from the South, in many instances, have not. If you are a Kentuckian living on that border, I need you to not go to Tennessee for anything other than work or helping a loved one or maybe the grocery if it is there closer. if you ultimately go down over that border and go to a restaurant or something that's not open in Kentucky, what you do is you bring back the coronavirus here in Kentucky. And again, the sacrifice that the people inside your county are making, ultimately, you don't honor by doing that. And what we are seeing is in many of our counties, the local health departments are pushing and trying to make sure that their strong efforts, because they are working hard, are not frustrated by this. I cannot control that Tennessee has not taken the steps that we have. And what it means, because obviously you can drive anywhere, is that if someone does decide they want to go out to eat and goes to a crowded restaurant in Tennessee, they bring back that coronavirus here in Kentucky. So I need you to be even better, especially if you're living on that border. I need you to be strong in your pride in this state. And I need to make sure that you don't take someone else's lack of action and ultimately bring it back to Kentucky to harm us. Just to give you an idea, I mean, if you're living in Christian or Logan or Todd County, you just look at the number of cases that are just barely south of you, and they are significantly more. It means that if you're living in Logan or Todd or Christian County, you're doing a lot inside your county to do everything you can to flatten that curve. But just south, if you travel and then potentially bring it back, that can frustrate all of those efforts to flatten that curve. I do want to, in Christian County, we got two great folks, Rose and Rosetta Jackson. They've launched an Adopt a Grandparent plan to where they are connecting people that can provide services, groceries, and other things to grandparents down there. Thank you for your leadership. All right, so tonight's update has what viewed in context you could say is okay news, and then has some tough news. So tonight's update is that we have 54 new cases of the coronavirus here in Kentucky. And while that is slightly more than yesterday, it is really close, and that is a good sign. Now, we can't just do this day to day, but in other places, the numbers of cases are growing much more significantly each day. Now, we expect the cases to elevate. James, if you could put up Philadelphia versus St. Louis. Again, I know I show this slide every day, but it shows even if you're doing everything right in a pandemic like this, the cases still escalate before they flatten out. And while we're fighting really hard to be St. Louis, remember, they still had increasing cases before it flattened out. And so while today the 54, I believe, is the most we've reported in any individual day, its increase versus yesterday is small. That's what we've got to fight for, knowing that we're going to see more cases each and every day, but we fight to keep them as low as possible. Some of the new cases by county: 1 in Boone, 2 in Bullitt, 2 in Campbell, 1 in either Christian or Todd, 1 in Davis, 4 in Fayette, 3 in Hardin, 19 in Jefferson, 3 in Jessamine, 3 in Kenton, 1 in LaRue, 1 in Logan, 1 in Oldham, 2 in Pulaski, 2 in Scott, 1 in Simpson, 1 in Warren, and 3 in Woodford. And again, these numbers are going to be slightly different than what you may hear from a local health department because we got so many labs out there, they can take different days, and they have to report back to us. All right, our tough news of the day is today we've had 2 additional deaths due to the coronavirus. They're a 75-year-old female from Fayette County and a 77-year-old male in Hopkins County. I want us to think about their families. I want us to pray for them and their loved ones. And tonight, we're not only going to be lighting up the governor's mansion, we're going to be lighting up the dome of the Capitol green to show our compassion for those families. And I'd like everybody else out there to do it as well, if you can. And tomorrow, like we've asked every day, I'd ask for our houses of worship or anybody else to ring their bells at 10 a.m. Normally, we do it to let those that are out there that might be living alone to know that they are not alone. But let's also do it for these two individuals. We haven't lost two in a day until now, and I know it's hard, and I will tell you it won't be the last time we do until we are through this. And the stakes are very serious and very personal. And while you or I might not know these two individuals, there's a whole lot of people that do. There's a whole lot of families that are going to be missing their loved one tonight. So please know that while I always want to talk in terms of encouragement, and I always want to try to get us to follow all these rules through the positive, that what we're doing is very significant, in some instances a matter of life and death. And I want to make sure we have as few of these announcements as we can, because today we lost two of our Kentuckians to this. And while we know that there will be more, this is our fight and this is our battle. This is why you are sacrificing so much. And we know that we haven't quite seen the surge that is coming. And so let's dig in. Let's make sure that we are decreasing our contacts. Let's make sure that we are following the When to Seek Care infographic, because while it didn't impact these individuals, in the coming week, maybe the coming 2 weeks, what could cause more of these deaths is if we don't have the capacity in our healthcare system. So let's make sure that we follow this infographic as we move forward. I've been asked a question yesterday. I did not have the answer to it. It was the number of ventilators in Kentucky. I believe it's 1,352. We are working to augment that by at least 71. And every single day we are out there working to make sure that we have more capacity. If I can, every day we try to thank people out there. We thank our healthcare workers. We thank our grocery store workers who are dedicating their time, care, and energy to making sure that you can just shop for a week and not for a month. They're the ones making sure our food chain supply is there and is strong. Thank you to them. Thank you to the businesses that are fighting to protect their workers, that don't look at being the exception, and if they do fall in one of the exceptions, have changed and sometimes significantly changed the way they do business to protect their workers. Thank you to everyone every day that's donating PPE. You can't know how important that it is. Thank you to the local TV, radio, and news stations that are streaming these updates that help us not only get you accurate information, but help us come together once a day in a sense of normalcy, to know that we're going to get through this and we're going to get through it together, but also to remind us of how important it is in what we're doing. I want to thank all of our houses of worship, our churches, synagogues, mosques, and others who are abiding by the guidance, who really want to see their congregations, but know that they're keeping them safe, doing it virtually or in the other creative ways that we are seeing. Thank you to our first responders, our healthcare workers, our teachers, our maintenance staff, and thank you for all of you Kentuckians that are doing your part. It is incredible and overwhelming to see you see this as your duty and to protect each other, even though most people you're protecting you'll never see and you will never know. I've always believed this Commonwealth is such a special place where we have a more of a sense of home and a sense of belonging than anywhere else in this country. You are proving that right now. Now we got to prove that we are resilient enough to continue putting humanity and our fellow person above our self-interest or our itch maybe to get out over the weekend. Going to go over just some steps that we've taken to date, and then we can move into some questions. We are still under a state of emergency. That unlocked the resources that we are using right now. Our Emergency Management Operations Center is up and running. Our COVID-19 hotline, 1-800-722-5725. It's receiving about 2,400 calls a day right now. That is primarily if you are well but nervous. And also our website. Incredibly important that we mention it every day, kycovid19.ky.gov. That is your source for accurate information. It is one source. It's the reason we don't have a whole lot of other social media or other ways. We want to make sure you are looking here. As you know, our elections, primary elections, are now at least moved to June 23rd, 2020, that we have done what's necessary to make sure that any testing or treatment of the coronavirus is going to be free. We have limited and or banned visitation to any of the senior type facilities that are out there. This is very important. Yesterday we thought we had a Perry County senior in a nursing home that had tested positive. Thank goodness that turned out to be incorrect, and I'm glad that I was wrong on that one. We have to make sure that we protect these facilities. It's incredibly important, and that's why just someone who refuses to limit their contacts, who doesn't follow their guidance, who thinks everything is okay, but then transfers the coronavirus to someone else, who transfers it to someone else, who goes home to a parent who happens to work in a nursing home, is how we could see ultimately significant damage. And we can't let that happen. We've now taken steps, or localities have taken steps, on 3 separate individuals who refused to self-quarantine. Thank you to those localities for stepping up and doing what's necessary. I've said it before that this is a time when there aren't Democrats or Republicans, only Americans versus the coronavirus. And in every area that this or anything else has been needed, our local leaders have absolutely proven that. Thank you for what you're doing. We put out tips and guidance to support good mental health. If we could put that up, James, it is so important in this to stay mentally, emotionally, and physically strong as we move through it. We've now, as you know, had to close so many businesses for in-person traffic. We wouldn't have done it if it wasn't necessary, and we believe that it is working. But we are going to have to stick with it, and I wish I could give you an exact timetable, but we have to defeat this coronavirus on our very first try, and I don't want to frustrate your sacrifice in doing something that is not what it takes, and to make us go through this multiple times. Let's get it right on the very first try. We have provided where we can, especially economic relief for our first responders if they are quarantined. We've expanded unemployment, which we talked about today. Remember, our banks are well capitalized. There is no need to go and to take out a lot of cash. We have qualified for the Small Business Administration disaster certification. We've moved our tax deadline. That's important. It's near the end of March. It's not April 15th. It is now July the 15th, and we are making sure that there are no penalties in Kentucky for it now being July the 15th. We've extended the executive order to prohibit price gouging. I get some of these reports. Make sure you call the AG's hotline on that, and that we continue to work and to plan every single day to make sure that we are as far ahead of this as possible. That is everything from planning to turn various hotels into additional hospital space if needed. It's our attempt to gain extra healthcare capacity by finding other ventilators out there that might not be in the place where they would be needed. It's making sure that we know the full capabilities of our National Guard on the medical side if they are needed. It's doing everything we can every day to where when there are an even greater surge of cases, we are going to be as ready as we can be. But the main thing we need is we need all these things that we talk about every day to become a natural part of how we react. Because the coronavirus creates incredible anxiety. And the moment you might cough, I know, the moment you might cough, I've got seasonal allergies, that you want to either rush out and get a test or go to your doctor. Folks, we have to make sure that we conserve resources. With a nationwide shortage of personal protective equipment and not enough test kits out there, that we continue to work on that. And I hope that we will have a bigger announcement soon. We have to be that good neighbor. We have to know that if we are otherwise healthy, that we've got to make sure that that person who really needs it has that kit, has that hospital bed, or if we get there, has that ventilator. This is our test of humanity about how good we can be to each other. So with that, I'll open it up. We'll do about 10 minutes of questions, and I'll go back and forth between people who are here today and questions that came in. Yes?
Can you give us some insight into your conversation with Governor Lee? Have you expressed these concerns to him?
The question, since I've talked about Tennessee, is my conversation with Governor Lee, and if I've expressed it to him. I will admit I have not even called him. I'm working every single day to do everything I can to protect Kentuckians. Admittedly, I am frustrated that there are some states around us that haven't taken the same steps, though. I don't know his reason. I do talk to Governor DeWine in Ohio regularly. We talk every other day to every day. We knew each other as attorneys general, and I think with him as well, that politics never come into this. It is always a conversation of how we're doing our various things and how being neighbors and both being aggressive at the same time can help both of our states. Asking about the stay-at-home order and what people should do traveling in and out of the state. Folks, don't travel. Don't travel. What we need you to do is not only not travel out of state, but don't travel. We need you to be healthy at home. And what that means is if you're going to work right now, you go to work, but otherwise you stay at home unless you are getting groceries or other supplies that you may need. Remember, your kid needs shoes. You can order them online or on the phone, and you can get them at the curbside. And other than that, only getting outside really for exercise. We have to limit our contacts. We pull up the Seattle line graph, and we've been showing this from the start, but it continues to show how important what we're doing is, right? This is cumulative infections, and this is from very early on in Seattle. I mean, we're in a very different world than this right now, but it is a good example of the fact that if we don't travel, we stay healthy at home, and the only things that we leave our homes for are exercise and getting fresh air, but only with our family, and then with social distance for anybody else, that we can work to be as close to the red line as possible. We got a question, does the Healthy at Home initiative amount to telling Kentucky residents to stay home? Yes. It says the healthiest place you can be is at home. Now, that doesn't mean you have to cower down in your home. What it means is you can do what you need in getting groceries. You can get outside and take a walk or go for a run. But what we can't do is find ways to get groups of people together. The healthiest place for you right now, the healthiest place where you will, you're most likely not to get the coronavirus or not to spread it, is in your home. Phil.
I wanted to ask you, in terms of Tennessee, continuing on that question, have you considered, or do you have any authority to close the border? I know outside maybe of federal highways. Is that something that if this continues to escalate, again, you can't control what Tennessee does or doesn't do. Have you considered taking extra measures, such as closing the border and forbidding Kentuckians to go to Tennessee?
The question is, have I considered additional measures with Tennessee, such as closing the border or ordering Kentuckians, not to go to Tennessee? I think that we consider different options every single day. I'm not there yet, but we're going to have to look at what it's going to take to make sure that if in Logan County all of these restaurants have shut down, that sacrifice is simply not frustrated by the county to the south. It's not fair to those individuals. It's not fair to those that are doing it right. And what it presents an extra danger to a Kentucky county that is doing the right thing. How is the state working to prevent the coronavirus from spreading in our jails and prisons? We took a lot of steps early on in this. One of the most important was restriction of visitation, and that is really hard on the inmates and on those that are in jails, but it significantly cut the number of contacts and how it could be transmitted. The other thing that we have done is the judicial system is not sending as many people in to the jails, especially depending on the crimes. And what you're seeing is some releases, especially from our local jails. We are still looking at options on the state side. We want to make sure it's done correctly. We want to make sure it's done safely, but we are looking at options there where some whose term is almost over, where it's right at the end, or those that are medically fragile and haven't committed violent or sex-related crimes, that we might be able to do a little bit better for them. Unions are pushing the federal government to get first responder status to grocery store workers. Can you provide a statement on this, and if you believe they should be considered frontline workers and have this status? I've been asked this question before, but they are definitely frontline workers right now. We need them. We need to make sure that we have enough grocery store workers every single day. So I will consider whatever it takes to make sure that those brave souls, knowing that they're going to come into contact with a lot of people, have the protections that they need. Is there any update on plans to convert hotels into hospitals with additional beds if needed? We are working with at least 2 hotels right now. We have agreements that are close to where hopefully we could turn that key and in a week or less have them up and running. Phil? This Phil, sorry. We have 2 Phils today.
Can you clarify where exactly the 2 desks were? The Fayette County Health Department is telling us they don't have any desks. Was this a Fayette County resident or somebody?
That's a problem with the data. So Phil Pendleton is asking if we can clarify the Fayette County death, saying that Fayette County says they don't have one. What we get is the county that the test is from until we get further data on that. So we'll give you clarity as we can on that one. And then the other is in Hopkins County.
Just one other question. I haven't heard it answered, and I don't know if you know the answer to this, but if you get COVID-19 and say you get over it and you get better, can you get it again?
The question is a good one, though there's not a certain answer out there for it. It's that if you get COVID-19, the coronavirus, and you get over it, which we're now having a lot of people do, which is a great thing, can you get it again? And the answer is right now the scientific community can't tell us, but they hope and they believe at least they at least have a good faith belief that you will build up at least certain immunities. Whether or not that means that you couldn't get it again or it wouldn't be as bad, no one knows. In fact, they can't tell you for sure right now that you couldn't get it again. But what they will say is that with other viruses like this, that you are certainly less likely to get it, and we're going to find out here really soon. And if that's the case, then there may be other opportunities to help those that get it down the line. You know, it would be it'd be an amazing thing if you did develop an immunity, which we don't know that you will, and that gave you the opportunity to then turn around and help other people who had it. And you know, I could see hundreds of Kentuckians, maybe even more, wanted to take advantage of that, just like we've seen them do so many amazing things. Following up on an Amazon warehouse in Shepherdsville that's closed for the time being, they say by the order of the governor, trying to figure out whether the company is referring the broad non-life-sustaining business closed yesterday or something specific from the governor's office that may have singled out this particular facility. We had a facility from Amazon that had several positive tests they needed to shut down for a period of time to ensure that it was a safe environment. They will be opening again soon. They have worked with us each step of the way. But yes, I definitely got involved in that one. It's because it's my job to protect folks. Not that it would have been necessary for me to get involved, but I wanted to make sure that we were doing the right thing. And I appreciate ultimately that that company is giving the time to make sure that we can trace through folks that may have been exposed and ultimately find those people that need help. I heard from Northern Kentucky residents that there is a church in Florence that's still holding services against my order for churches to close during the pandemic. They said people have called the hotline. That may be accurate. Folks, we can't still be doing some of this. You know, I'm a person of deep faith. So are so many other people that have made the sacrifice not to go to an in-person service. And sadly, so many of these in-person services, a large part of the congregation is either older or falls within the risk categories. God would not want to put our people at risk in this way. I know that in my heart. Part of my faith says God gives us wisdom, and so many faith leaders out there that I respect so much have agreed and are finding new and amazing ways to provide their services. Please, please follow these directives. Don't expose folks that might be the most vulnerable, and don't make it a test of faith for them to come. No, please, just do the right thing.
Obviously, you're working every day to procure critical supplies, but have there been any conversations about sending other resources, including possibly medical personnel, to hotspots like New York and New Orleans?
The question is, have we had any conversations about sending medical personnel to other hotspots in the country? I don't think that's been requested of us at the moment. And so what I've been doing each and every day is preparing us for what we know is coming. Now, one thing that we all should be doing across the Commonwealth, and our local health departments do this a lot, is making sure that we know of every healthcare professional that's out there, and including the recently retired, or those that have allowed their license to expire and may have gone into another field, so that in every area of this state we have a catalog of those folks that we can count on when we see what we will see, to make sure that we can handle the surge of cases that is coming. I, like you, watch the news. My heart goes out to the areas that are being hit hard, and I hope that it serves as a warning to us about what we're doing is real, but also that we have some time, that our social distancing can keep us from facing something that significant. And let's face it, while they have more people in some of those areas, their healthcare capacity may also be greater, and it's still being overwhelmed. So right now, it's about digging deep. It's about not wanting what's happening in New York or New Orleans or California to be happening here. This is our chance to work to prevent, and we won't be able to prevent a significant increase in cases, but to prevent some of the situations we're seeing out there.
Governor, continuing to the Tennessee issue, I guess, if or when you speak to Tennessee Governor Bill Lee, what would you say about what's happening at our southern border, and what would you ask him to do that he isn't doing to protect both his citizens but also protect Kentuckians?
The question is, what would I tell Bill Lee, who's the governor of Tennessee, in a conversation? I would say he needs to do everything that we and Ohio and Indiana has taken a lot of steps have done. We are all neighbors. This isn't a time for partisanship, but if you look at that, I'm the only Democratic governor in those three. We're all just trying to do the right thing. And this virus doesn't care about borders. County borders, state borders, it doesn't care. And we can be doing all the right things here or in Ohio, but if someone from an area where the coronavirus is spreading because they haven't taken aggressive steps simply drives to one of those areas, then boom, it can start spreading in that area. Though if we are engaging in social distancing, we can at least decrease the amount of spread there. So what would I ask him to do? I would ask him to close restaurants and bars to in-person traffic. I would ask him to close the forward-facing businesses, just like we have. I don't know what he has done on elective procedures, but we are seeing a large number of cases there, just like everywhere else. And I'm not here trying to criticize his leadership. I'm just here trying to protect my people. I just want to make sure that all of our surrounding neighbors are doing everything they can because it gives us an extra level of protection. I see that in Ohio, and I've talked to Governor DeWine personally. I haven't talked to Governor Holcomb personally about it, but I see a lot of steps that they are taking. We will be better protected as a state if our neighbors are also doing the same thing. But because I can't control what another state does, I have to ask our people, especially in those border counties, to be even better, to know that maybe the temptation of going over to a restaurant is greater for them because it's so close. Please don't do it. The people in your county and the people of Kentucky are counting on you. Will churches or faith organizations be eligible for coronavirus relief assistance? That's a good question. We're still looking at what and how we're going to be able to provide relief here in Kentucky. We certainly hope to provide it to as many folks out there as we can. I'll take one more question here, and then I have a video that I want to close us with. People have claimed that they cannot access the unemployment website. Is the governor planning on addressing this? The answer is yes. We talked about it. We have a bigger surge, and now we have new categories that can apply, which means the server, the structure wasn't ready. That's because we're facing a new reality. But I didn't want to wait an extra day in letting you know that this is something that we're going to be able to do. So please bear with us. I want to close with a video. We've had a number of Kentuckians and prominent Kentuckians that have reached out that want to help. In part, you're going to hear the Team Kentucky Fund talked about. This is a way that we're going to be able to help folks out there that have been impacted by the coronavirus. Now, this video is from Coach John Calipari. We're going to have a video tomorrow from a basketball coach from a different team, but this is one that Coach Cal reached out and wanted to be of specific help on. Thank you all very much. We will get through this.
This is Coach Cal.
We'll get through it together.
Knowing that we're all trying to stay home, that we're washing our hands, that when we leave we have social distancing. We're not touching our face. We're trying to keep this virus at bay, but we're also trying to help each other. That's what Kentucky is. How do we give back? What do we do to help someone struggling more than us? What do we do for our older families that are in our community? Do we get them groceries? How do we take care of them? How do we keep our kids in check? The governor started the Team Kentucky Fund. Again, tax deductible, you can give money to it, and it's to help those that are struggling even worse than any of us. I will tell you to get involved. Stay safe. Keep your family safe. You are responsible for you, and if you can, let's give back to others.